A revolutionary HIV prevention drug should be available to patients in low and middle income countries by 2027 at an affordable price. The drug, whose technical name is Lenacapavir, reduces the risk of infection by more than 99.9%. And it's the first long-acting treatment that can prevent a person catching HIV. Developer Gilead Sciences normally charges more than $28,000 for a year's supply. Now charities, including the Gates Foundation, say they will help 2 Indian drug makers develop generic versions of the medicine, and a year's dose will cost $40 per patient. Joining me now is Angei Achrekar. She's the deputy head of UNAIDS. Welcome to DW. It's a pleasure having you on the show. Your organization has been advocating for cheaper versions of drugs to prevent HIV for a very long time. How significant is this?
First, thanks so much for having me on. This is truly a watershed moment in the HIV response. This is something we've been waiting for, we've been advocating for, and now we're at the moment where this is really going to make a difference for millions and millions of lives and actually help us get to the end of AIDS as a public health threat by 2030. It's extraordinary.
Who exactly is this drug for?
Well, as you said, first off, it's really important to remind everyone how incredible this drug actually is. Remember, there are every year 1.3 million new people getting infected with HIV and AIDS. So we can never turn off the tap as long as new people continue to get infected. So this drug, Lenacapavir, that is an injection twice a year, that's now affordable, $40 per person per year, is making it accessible to millions and millions of people. What's important is that this drug is really targeted to where infections are spreading. So we want to make sure we get it into the hands, into the arms of as many people as possible, those that are adolescent girls and young women, for example, that are at risk of getting HIV on the continent of Africa. We want to get it to people that are at high risk of HIV as well, those people that are key populations, men who have sex with men, sex workers. We want to make sure that we are going where we are seeing, the data are telling us there are new infections on the rise, and we want to focus in those geographic areas and among those populations.
It's supposed to be available in 120 countries by 2027. How is rollout going to work, though, especially in areas with an unreliable healthcare infrastructure?
Well, first, it's going to take partnership, and we are really, really excited about this announcement today and the partnership that we all have. UNAIDS, CHI, Gates, country governments, many, many others. This is going to take all of us working together, continuing to work together. The way it's going to roll out is we have to make sure that we're, again, using data to focus where the drug needs to roll out among those populations and those geographies. We, as UNAIDS, we work at the country level, working directly with governments and communities. We need to make sure that there's a demand from the communities for these drugs. We need to make sure that policies are in place so that the drug can be accessible to all. So this is really going to take a partnership across the Global Fund, across UNAIDS, across UNAIDS, across many governments working together hand in hand with communities to make this happen so that the drug is moving from a supply chain warehouse, if you will, into actually being accessible to people that need it.
It's not a vaccine, but it is pretty close, and it's as close as we've gotten so far. Could Lenacapavir be enough to end HIV/AIDS around the globe?
As you said earlier, this drug, we are talking about it as a potential miracle drug. Right now, the fact that it is nearly 100% effective at stopping new infections is remarkable. It's unprecedented. It's the best thing we've got in the HIV response. We do not have a vaccine or a cure, but this is extraordinary. So what's going to be important is rolling this out quickly, as broadly as we can, in a very targeted way to the populations that need it. And we have to continue to make sure that treatment, those people living with HIV, are on treatment and virally suppressed. So we have to continue to push this prevention together with treatment. And yes, we can end AIDS by 2030 if we roll this out and continue to track the progress of how it's going.
That's Angei Achrekar, Deputy Head of UNAIDS. Thank you so much and all the best for the road ahead.
Thank you so much.